Good evening, everyone. May I have your attention, please? I would like to recognize everyone here, the mayor, our staff liaison, and all of that, and call our meeting to order. And we will begin by taking roll of the present subcommittee members. I am Heather Coleman Cox, Chair. Michael Schultze. If you are here, say so. If not, you won't. Sydney Powers. Mark Garber. Scott Lewis. Nick McWilliams.
Here.
And Teresa Tashirky. All right. So do we have any public comment?
No, we do not have anyone signed up for public or written testimony tonight.
All right. So now I'd like to move to accept the meeting minutes from our first meeting. The subcommittee members will find these meeting minutes in their packet, and community members will find the minutes posted online after each meeting. Would any members like to make a motion to approve the minutes?
I'll move to approve.
I'm sorry.
Oh, Mike. I'll move to approve the minutes.
All right, and can we have a second?
Second.
All in favor, say aye.
Aye.
Aye. All right, those opposed say no, and we have all in favor. So the motion is approved. We have a very special treat tonight. We are going to have a presentation by our fire chief, Derik Minard.
Good evening, Chair, Committee. I'm Derik Minard. I'm the Fire Chief of the City of Gresham, and it's an honor to be here tonight to give you an overview presentation on the Gresham Fire Department. And I would like to say that at the end of this presentation, and when this meeting adjourns, that the committee will be invited to go on a tour of Fire Station 71, which is also co-located in this building. So we'll have that tour when we're done with this presentation. Okay.
Thank you.
Okay, we're going to get started. A lot of ground to cover. So we are a very busy fire department that provides a lot of service to the city of Gresham and the surrounding cities and county. So we're going to jump into it. Okay, so the Gresham Fire Department is committed to the city of Gresham and to the surrounding communities. And our mission statement for the fire department is to protect life, property, and the environment by responding to fire, medical, and rescue emergencies while providing education and prevention services. So that's what we are here to do. Our vision of where we are going is we welcome the future and accept that change is constant. Through self-reflection, planning, study, and dialogue, we will welcome innovation and listen honestly to new ideas. We will pay attention to changing industry science and update or improve our practices whenever practical. We will meet all challenges head on together. And then the values of the organization, the guiding values, principles, integrity, honor, compassion, and duty. The Gresham Fire Department was founded in 1910 as a volunteer fire department. The first paid staff were hired in 1967. The jurisdiction for the fire department covers the city of Gresham along with the cities of Fairview, Troutdale, and Wood Village through a contract agreement that we have with them, as well as unincorporated areas of Multnomah County, also known as District 10. We have a close relationship with the city of Portland, and we share response out of one of the fire stations, Fire Station 31. So they staff at 2 shifts. We have 3 shifts, A, B, and C, and they staff at A shift, C shift, and we staff at B shift. And I'll cover more of that later. I'll give you more detail on that. We have mutual aid agreements throughout the state, but we also with Clackamas County and Washington County, those are established through Multnomah County. Gresham is a community with vast residential, commercial, business, and open space. We have a lot of transportation with major highways and rail and the connection to urban and suburban living. Gresham, we serve the community with all hazards approach. I'm going to get into what that means in a moment. We work with surrounding municipalities and jurisdictions in areas of automatic and mutual aid, which is very important in our business. And Gresham Fire serves the cities, counties, and the state of Oregon, as well as the United States in response to wildland and hazardous materials. Gresham Fire believes that collaboration and serving each other to fulfill a common vision and mission. So when we get into all hazards department, what does that mean? Well, what that means is when we're called the Gresham Fire Department, people think of fire. We also provide EMS for the areas that we serve. EMS is emergency medical services, and that is what we provide advanced life support at the paramedic level, as well as basic life support, which is they coincide, they work together. We do not transport, that is with AMR, but we do provide all of our engines are advanced life support, and so we are first on scene to provide that care. We provide hazardous materials. We're going to talk about hazmat a little bit more in a minute. Technical rescue, which is rope rescue, cutting apart cars to get people that are trapped out of that, and other technical types of rescue. We have a wildland team, wildland response. Last year, Gresham Fire responded to 18 different conflagrations throughout the state of Oregon. We have a USAR team, which is urban search and rescue, and that would be for a building collapse, trench collapse, that type of thing, and then water rescue. So resources, we have 134 members of the department, but we have 128 that are sworn personnel. We have 6 administrative staff. We're out of 6 fire stations. We staffed the Portland Fire Station 31, one shift that I mentioned at the beginning. We're going to talk more again later. We have 1 battalion chief on duty. A battalion chief is the person that is over the entire shift, but they're also the incident commander on large incidents. So if there's a structure fire, a large medical event, anything critical, the battalion chief is the person that is on scene, that develops the incident action plan and gives the orders on how we're going to mitigate the emergency. So we have 1 battalion chief on duty. We have 6 engine companies every day. And when we're in Station 31, we have that 7th engine company out of Station 31. We have 1 truck company, which you'll see later, out of this station. And then we have 2 rescue units normally, but then we have a 3rd, which again is out of Station 31 when B shift is on duty. A rescue, I'm going to get into what that means here in a moment. So Gresham, our org chart, you have in front of you, as you can see, the fire chief is at the top of the org chart, and then we branch out from there throughout the organization. So we have a senior administrative supervisor, Randy Deverell, who is our historian of the fire department, and I'm not sure Gresham Fire would exist without her, so we're grateful that she is with us. She is wonderful, and she oversees the administrative staff for the department. We have a senior management analyst, Bill Eggert. He is actually with the finance group, and he's embedded in the fire department. A very pivotal role for us when it comes to budget, spending, POs, those type of things. So a very critical role. The emergency manager for the city, Kelly Landavasso, she reports to the fire chief. Then we get down below me to the assistant fire chief, who's Jeffrey Harrison, and then we branch out into the training division, and then we have operations division, then the life safety division. So in training, that's responsible for ensuring that our staff is trained. Again, I have a slide for that. I'll wait for the slide instead of getting ahead of myself. But that's how the organizational chart is laid out. So we get in the operations division, we have the 3 shifts, and then we have the life safety division, which is the fire marshal's office and code enforcement, that type of thing. This is a map of our service area. So you can see that the outline, the red outline that surrounds the area, so the area in the middle of the red outline is our service area. So you can see that's the city of Gresham. North of city of Gresham, you can see Fairview, Wood Village, and the city of Troutdale. And then down to the bottom right of your screen, you see that we have Multnomah County Fire District 10. And so we have a station down in that area. So it's at 60 square miles, so it's a big response area. When you look at that area down to the southeast, that is a largely rural area, but with some suburban areas to that. But And we'll get into the call response here in a moment. To the east, to the right on your screen, that's Corbett Fire, the two pink and darker pink areas. And then to the west, the multicolor, that's the city of Portland. So that's where we fit into our response area with the river to the north, the Columbia to the north there. When we get into the budget and funding for fiscal year 25 and 26, the funding is generated from the general fund, the local option levy, and the grants and donations. Our general fund portion of the budget is 43.4 million. Local option levy fund is 5.9 million. And the designated purpose fund is 0.9. So those are things that, so I listed below the 500,000, that's from the state for the new training tower. So half of that is already designated for the training tower. So that's what that is for. And then below, the one-time costs, these one-time costs are embedded in the 43.4 million, the 5.9. But I just wanted to let you know that our budget looks really big this year because we have a couple of big purchases that we're going to do. We were purchasing 3 replacement engines, and for the engines and the equipment, it's 3.1 million. So that's what we have slated for that. And then the 1.7 million one-time cost is for the pension buy down that we're working with on the state. So those are one-time costs that normally would not be in this budget. When we look at the levy positions, you know, the very first night we talked about that we hired 9 positions to staff the rescue. We hired 2 people for the fire marshal's office. And then the question was asked about 13 people. So I wanted to put this pie chart in so you could see what this looks like, what positions we have that are applied to the levy funding itself. So this, we have through the levy to staff Rescue 72, we hired 9 personnel. So we hired those people in 2025. We had 7 people in the academy that were lateral hires. And then we have an academy now with 12 people, but only 2 of those positions are for the levy. So we end up with 9 people for Rescue 72. Then we had 4 positions that we hired through the ARPA funding. This was a question that was asked our very first night. That I believe it was Mr. Garber had talked about. There were 13 people that were on that list, and that's where that comes from. So 4 of the ARPA funds were converted from ARPA, because that's one-time money, to the levy. So those account for those 13 positions. We hired the 2 new deputy fire marshals. And then we have existing firefighters, 12 firefighters that have been moved from the general fund to the levy fund. So that accounts for that $5.9 million. When in those positions, we hired these personnel, as I mentioned, in 2025 to staff Rescue 72. So we hired 9 people to staff Rescue 72. That rescue unit goes into service on July 6th. So when July 6th hits, we have all of our firefighters in place, and we'll be able to staff the new Rescue 72 24/7. And and if we have somebody calling sick or whatnot, we're backfilling with overtime. So that will be in place. I mentioned that we had 7 lateral entry firefighter paramedics. That was the first time that in the history of Gresham that we've done that we actually hired people with experience. So we brought in firefighters that had years of experience as a paramedic, as a firefighter. So it's really helped enhance our services right out of the gate. So it was very good for us. And then again, I mentioned the 2 new entry level firefighters. The 2 deputy fire marshals that were hired, they enabled Gresham Fire to start back up school inspection programs. So we have those people hired, they're working, they're in place. To date, we've already performed 26 school inspections in our community. So we are getting after that, and we take that very serious, that's something we need to really make some ground on. It also allows Gresham Fire to become more active in community engagement and education. So we have had several weekends where the fire marshal's office, where these new personnel have been able to go out and install smoke detectors in people's homes. We went through different communities, different neighborhoods, and we've been able to do that. So we've already put these people to work. So it's really already affecting the community. Whereas hiring the firefighters, getting Rescue 72 in service takes a little more time to the hiring process, fire academy, and so forth. So I wanted to review some of the major initiatives we have for 2025, and some of these will be going well into 26 as well. So of course, we're going through the implementation of the funded levy positions, the deputy fire marshals and additional resource of Rescue 72. In August, we have the funding and we're going to demolish our training tower and we're going to rebuild it with a new tower. So that tower was approved in 1968. So I think it's due for a replacement. It's got a lot of good use throughout the years. And so we have a new training center that will begin in July, August. When I say the date, we're not 100% sure because the manufacturer is a little bit behind. So we're finalizing that, but we're still going to move forward into summer, into fall if we need to. We're going to review and finalize the schematic design for Fire Station 74's replacement. We can say this with a smile tonight because we had found out that we secured funding through the state of $8 million that is coming to the city of Gresham to help us build a new Station 74. We also secured $5 million through the urban renewal through that area, so that's $13 million. So now the city of Gresham, we're going to work together to, we estimate the cost to be in the 20 million range. So we are going to start looking at how we can fund the rest of that. So that, we just got that wonderful news yesterday. So we're very excited about that. And I would like to acknowledge our local 1062 president, Kevin Larson, who was a huge part of working with the state and our council and getting that done. So this year, we're also remodeling and adding a second level to Fire Station 72. Station 72 is, they're going to actually remove the roof of the building. We're going to add a complete second level because we have the new rescue unit that's going to be there. So this will allow us to staff people into the fire station, so in that response area. We just completed the addition of a fitness annex at Station 73. So what happened is the workout facility, the workout equipment was in the bay with the fire apparatus, and we're working at our stations to get that out. It's not a good mix of what we want to see. And so we built an annex on the back of the station, and so that has now been completed. And then we're going to continue to implement safety and health improvements for existing fire facilities. Okay, we're going to get into operations. And I thought it would be good to start with about what does that mean? Well, when I talk about engines and trucks and brush trucks and rescues, what is that? What do they look like? So fortunately here tonight, you're going to see an engine, a truck, and a battalion chief rig when we go into on the tour afterwards. But so an engine, that's the picture on the top right. So a fire engine carries hose, it carries water. When we arrive on a scene and we have a working structure fire, that's the apparatus we work off to pump water to the firefighters to be able to extinguish the fire. When we talk about a truck company, that's the picture, the second one down on to the left there. So a truck company, our ladder is a 107-foot aerial ladder, and that is designed if we need to go into defensive operation, we need to gain access if we have a tall building, or if we need to have a far reach, those type of things. So it's a different tool in the toolbox, if you will. So engines fight the fire. Truck company, they do search, they do rescue, they do ventilation. We have a different skill set for the people that ride that apparatus. The next piece of equipment we talk about is the rescue, and you can see that there in the middle. This particular rescue looks like an ambulance because technically it is, but it's not licensed as an ambulance. We do not use it as an ambulance. We do not serve the community as an ambulance. We are not licensed to do that. However, the rescue, we wanted an ambulance to be in our arsenal for our people. That if we have something on scene, if AMR is busy with their call load, that we can act if we need to, and we do, and we work that with our medical advisor. So we have added that to our fleet. And then the bottom one is the brush truck. As you can see, that is a pickup truck, and it has a water tank on the back, 200 gallons of water, and that is used for wildland firefighting. And so when we deploy on our conflagrations, when we were in the Rowena fire just last week, we deployed a Type 6 unit with personnel. And so the Type 6, we send it out with other apparatus from Portland, from the Port of Portland, other agencies around us, and we go together to fight the fire. So these are the type of apparatus that we have for our typical, I'll say typical firefighting. To us, it's typical, to most not. We look at the response map. We're going to talk about stations. And I showed you a minute ago where our stations were located, or the response area was for jurisdiction. But when we look at the map, Right in the middle, you'll see 74 and then 75 to the right. Then you drop down, you see 31, 71, 72. And then we drop down further, you see 73 and 76. I'm going to get into locations and what that means. So Station 71 is the station is part of this building we're in now. So it's right here at 1333 Northeast Eastman Parkway. Out of the station, we have an engine company, a truck company, a battalion chief, and then we also cross staff with our apparatus for technical rescue and urban search and rescue. So if we were to have one of those type of calls where we had a building collapse, we have a trench, we have confined space, they can take these other specialized apparatus to help perform the rescue. Station 72, it's at 500 Northeast Kane Drive. Station 72 has Engine 72 based out of it. It's going to have Rescue 72, and it's also our hazmat station. So the hazmat, we have a hazmat vehicle, and we are part of the state's hazmat program where we are hazmat team 3 in Gresham. So we are a state response. Then we have Station 3, 2301 Southwest Pleasant View Drive, which is Engine 73. We have Station 74, which is 1520 Northeast 192nd Avenue. We have Engine 74. We have Rescue 74 that is currently staffed out of that station. And then we have a brush unit that is housed there. So again, if we had a brush fire and we needed to cross staff, they could have somebody off the engine take that brush or off the rescue to the scene. We then have Station 75. This is in the city of Troutdale, 600 Southwest Cherry Park Road, and that's Engine 75 and water rescue. And I'll talk about water rescue in a moment. And then we have Station 76. This is the one in the southeast part of our response area, 30300 Southeast Dodge Park Boulevard, and that's Engine 76 and Brush 76. And then we have Station 31. This is the Portland station that we staff, 1927 Southeast 174th Street, Engine 31, Rescue 31. Then they have what's called a water tender in that station. A water tender is a large apparatus with multiple thousand gallons of water that we can take to a wildfire if we don't have fire hydrants. So it's a portable water supply for us. So to staff those stations online, we have 114 personnel. So out of the 134, 114 actually work out of the fire station. That consists of firefighters, firefighter EMTs, firefighter paramedics. We have a station lieutenant, station captains, and we have battalion chiefs. So they staff the apparatus. We have 3 shifts, A, B, and C. And then we work, our work schedule is, so our staff works 1 day on, then 3 days off. Then they work 2 days on, 3 days off, which equates to 52 hours a week. So that's their work schedule. So when they come to work, they're committed for a 24-hour shift. They're off for 3 days, and then come back to work. They're committed to 48 hours, and then they're off 3 days again. Okay, I just spoke to the positions. So minimum personnel per shift. So this is what we have on duty every day as a minimum. One of the things that we are minimums, we call it minimum staffing. And what that means is that if we have one of these people call in sick or they're off for whatever reason, vacation or whatnot, we have to fill the position because if to make all of these apparatus work and to have full staffing, we have to have this amount of bodies on duty every day. So minimum personnel per shift, 1 battalion chief, we have 2 captains, we have 5 lieutenants, so we have 7 apparatus, and then 19 firefighters, EMT, and firefighter paramedics. So then I have an asterisk there, B shift adds 1 captain and 5 firefighters for Station 31. Because out of Station 31, we have an engine company with 3 people, and we have a rescue with 2 people. So our apparatus deployed on the right, 1 truck, 6 engines, 2 rescue units. Again, B shift adding the engine and rescue. And then we cross staff. Cross staff means that their primary engine, they might be on a primary engine or a primary truck. But if we have a specialized call for wildland, we might take those unit. And I mentioned the water rescue. We'll take the water rescue equipment or heavy rescue equipment and so forth. So the two type 6 wildland brush trucks, water rescue. We have a watercraft and a boat. A watercraft is like a jet ski that we use on the Sandy River. Heavy rescue, and then the state hazmat vehicle. With our EMS services, again, that stands for Emergency Medical Services. We provide advanced life support from our engines. So when we arrive on scene, we have the heart monitor, we have suction equipment, we have medications, we have drugs, we have the things that we need to treat people on scene before an ambulance arrives. We have all the same equipment on a fire truck, other than the bed in the back of an ambulance, that an ambulance has. We carry the same medicines. We can treat the cardiac arrest. We can do all the same things that an ambulance can do. So it's important when we get on scene that we have early CPR, that we have early what's called defibrillation, where we're getting pads on the chest through with the heart monitor, or AEDs that you may be familiar with. And time is of the essence. So we have staffed all of our engines, our trucks, all of our units are advanced life support. So oftentimes in a fire-based system that we have in combination with a private ambulance, our stations are stationed strategically throughout the organization or throughout the city, our response area. The idea is to, what we're shooting for, we're going to talk about data here in a minute, but 4-minute response times. Ours is about 5.5 minutes, which is very good for a suburban environment like ours. So we're on scene in 5.5 minutes, less than 5.5 minutes, 90% of the time. That's important. Ambulance companies it's different. They're not in the station with us. So they're out roving, they're moving. They may stage over here, and depending where the call comes in, they shift, is how that works. Our people are stationary, so we know that our response times, our response is going to be much more effective than the private ambulance company. And these systems they're really designed to be that way since we have taken on the ALS responsibility in our community, and the way we've established our effective response force. So I'm getting way more detailed than you need right now, but yeah, I get on my soapbox and here we go. So out of all of our staff, we have 69 paramedics. We have 46 EMT basics. So paramedics are the advanced level that are trained for the cardiac and the medications and drugs and administering a high level of care. 46 EMT basics, equally as important. Studies have shown that basic life support is what's saving lives more so than this advanced medicine, because it's airway management, stop the bleeding, good CPR, those type of things. So again, it's a team, it's effective. We have to have both to be effective. Again, we have 2 frontline rescue units, and when we put those into place, the idea is to get the rescue units there. They're more nimble to handle a lot of what we call the lower acuity calls, those that aren't as critical, and just to help take that call load off at 74 and 72 off the engines. And our ambulance provider is AMR. So that's who we work with.
Can I ask one question, just
Sure.
so I'm trying to get it straight in my mind? So the 69 paramedics, a lot of those are also firefighters, is that?
Yes.
Okay.
Yes, that's a great question. So when I talk about paramedics, they're all firefighters,
Mhm.
and the 46 EMTs are all firefighters. Yep, so they do both. Special operations, this is a whole nother side of what we do. So the wildland, I had mentioned that earlier. So we have a wildland team that deploys statewide, nationwide. We were in Los Angeles for this last fire, so we had a team down there. And when you fight a wildland fire, it takes all of us. It can't be a single agency. It can't be a single state. It can't be Portland. It can't be Gresham. We all have to do this together. So we have a system built in Oregon that when we have a large fire that happens, like Rowena, we were there last week, that they call for resources and then we respond. Our priority is to take care of Gresham first and our response area. So the 3 cities, Gresham, District 10. And we look at our staffing, we look at our resources, and we make sure that we have enough to send out on the wildland deployment. If we have to hold them back to protect Gresham, that's what we do. That's our number 1 priority. But if we have and we're able to assist, we assist. So we don't like to say no, but we certainly will if we need to, because this is our priority. Technical rescue, I mentioned that earlier. We have what's called hangle rescue. That's ropes. You've seen people being lowered down by baskets and out of trees and off buildings and that type of thing. So then we have confined space if somebody gets trapped underground for whatever reason. We have trench. When people are working in a trench, if they don't have the proper pieces in place to prevent the collapse, then if it collapses, we have the equipment to get them out. So it's a lot of cross training. It's a lot of things, building collapse as well. So urban search and rescue and technical rescue really blend together. Urban search and rescue, we think about, the Hurricane Katrina, we think about, unfortunately, 9/11 with the big building collapse, being able to go in and we're trained to how to maneuver through those situations in buildings and make sure it's safe to look for people or any victim. Hazardous materials, I mentioned this earlier, we're part of the state of Oregon has, I don't remember the exact number, I know somebody up there that does, hazmat teams throughout the state of Oregon, and we are hazmat team 3. And so what that means is that we have an apparatus from the state of Oregon that they pay for that. We pay for the maintenance, the upkeep, and we maintain it. And when we get a call into the Gresham area or a response area, we have a region around Gresham and it stretches further east and south, then we go on those type of calls and we help mitigate the hazardous material call. But we also do the training for other departments too. It's not just about response, it's also about training. So it's a big responsibility. Then finally, we have water rescue. So our Station 75 that's in Troutdale, we have what's called a watercraft, and that is for responding on the Sandy River. It looks like a jet ski, and it's because the water is so low there, or can be low, and then the sandbars and that type of thing in the river, that we use this apparatus to go in and to effect a rescue. Then we also have a boat that if we have to go into the Columbia River. So we have part of the Columbia and then we have the Sandy. So that's what we respond to both. So we have people on all of these special teams I talked about are staffed and trained, certified to handle each of these. So you're trained as a firefighter, you're trained as an EMT or paramedic, you're trained as wildland, and those are certifications that you have to maintain on top of the firefighting and everything else. The same thing with technical rescue and urban search and rescue, certified, many certifications, then hazardous materials. We have people on a team that could be chemists. So that it gets to that level of detail where we can go in and pull a substance and figure out what it is. It's pretty amazing. And then the water rescue team's a very specialized treatment or team.
Quick question on,
Please.
quick question on the wildland deployments. Do you all receive reimbursement from the jurisdictions where you deploy folks?
Great question. So yes, we do. So when we deploy, like the Rowena fire, for example, that the people that we sent to the fire, the overtime backfill to make sure we have Gresham covered is all paid for by the fire. So we bill for that fire, we bill to the fire, if you will. And the city of Gresham, so our city council and city has agreed that we would pay our people up front, and our people get paid, and then the city gets reimbursed 6 months, 8 months, 9 months down the road. And just like Los Angeles, for example. So we had a team down there for 18 days. And so we're billing the state of California for that. And we do it through the fire marshal's office for the state. We kind of all do it together, send our packet together, and then get reimbursed together. Yeah, thank you for that question. Any other questions at this point before I move on?
I did have a question. When you said you had a 5.5 minute time response time, how do you determine where you build a fire station? Is it by the number of people geographically where you need to, like, how is that determined?
So when we look at its response time, so we have different mapping system. One's called Esri, and what you can do is it's a wonderful map system where we can pull it up on a wall and we can see it just like on the screen here, and we can actually put a fire station or just plot a point and say, okay, this is going to be fire station 71. Now we can ask Esri to show us a 4-minute response time, 5 minutes, 6 minute, 8 minute, 10 minute, whatever we want. And then it maps it out. I mean, that fast.
Okay.
It's pretty amazing. And so what we do is we take a look at our current fire stations and then we map that out at 4 minutes, 5 minutes, 8 minutes, and 11. There's different benchmarks for different things. So I won't get into the details of that. But so we look for holes, we try to identify gaps. So when you look at national standards, ideally you want a response time of 4 minutes. That's New York City, that's Detroit, Boston, where their stations are every few blocks in the big cities. So that's a reasonable ask. Portland, I don't know the response time, but I've seen their stations and they're pretty dense downtown. In a city like ours, we, as a fire service, agree that about 5.5 minutes, 5.5 minutes to 8 minutes is what we're looking for. Now, of course, we want it to be as low as possible. So we use the mapping, we identify, if we decide we're gonna say 5.5 minutes, we look at the map and then we identify the gaps in service. Okay, our city has grown. We know that this is coming in, these subdivisions are coming in. We need to plan, we need to think about this. We need to start taking a look at what our response times will be to these particular areas.
How often do you reevaluate that?
So the last one was done, I'm looking over here again at Scott, but the last one was done, so in 2022, we had what's called a standard of cover. So a standard of cover is a wonderful document that really gets into the demographics of the community, the needs of the community. It's a hazard assessment. We're looking at natural hazards, man-made hazards. We look at every response district. We know everything that's going on in all these districts we're talking about in detail, finite. We know exactly what that looks like. So we know, where do we put the brush trucks? Where do we put the hazmat? Where do we put TRT? What station makes the most sense to get the best coverage? And so that's how we look at that. And so then it's a very involved process. So in 2022, standard of cover was done. About a year later, then there was a station study done that identified where our gaps are and things to think about to work towards, in the southeast part of the city, up north, in the middle. And so that's how we do it. And with data, we evaluate the data continually. We take a hard look at it quarterly, and we look at our benchmarks, our turnout times, response times, what's called a total ERF, effective response force. So if you have a structure fire, we need 19 people on scene in X amount of time, under 11 minutes. How are we doing? How are we meeting that? Those type of things. So we're always looking at the data. And so, like adding Rescue 74, what is the need? Where's the need? When you look at District 74, that district had or 72, that had almost 5,000 calls for one engine company. That's very difficult to keep that up. We get into a whole nother thing. I love to talk about this stuff. You're going to see this here in a minute. Reliability, resiliency. And so how reliable in the service, and are we making up the back end for them being out 5,000 times? They can't run 5,000 calls continually. And so that's why we put a rescue there.
Right.
Same thing for 74. 74's numbers were getting very high, so we put a rescue there because the data showed that's where they would make the most impact for the citizens.
Okay, thank you.
Yeah.
Question also, what's the distinction between sort of a rescue and the AMR vehicle? Like, when does that transition sort of out of Gresham's hands over to AMR? And like, how does that distinction work?
Meaning that when we arrive on scene, when we transfer the patient over?
Yeah, how does it, yeah, like what, so you've got a scope of service and then the ambulances have a scope of service. And
Yeah.
like, I'm curious the interaction between the two.
Okay, so the way that works is that we work in Multnomah County and we have a medical director for Multnomah County. So all of us that work in Multnomah County all agree to work under Dr. Zhu's guidance. So he develops what's called our protocol for advanced life support, basic life support. And all of us agree that we're going to work under these methods. So we're given the same medicines, we're doing the same treatment, we have the same authorities. We have to call in and talk to the ER doc for certain things, and we all agree to that. AMR agrees to that as well if they want the contract. So that's how that works. So we arrive on scene first. Our paramedics in charge of the patient because we're there first. We're with the patient, and then when the AMR gets there, then we do a handoff just like in the hospital. When you have a nurse comes in, takes all your vitals and history, this, that, and the other. Doctor comes in, gives the report to the doctor. It's very similar. They come in, AMR, we give a full report, hand information over, and then we help get the patient out of the home into the back of the ambulance. If it's a critical patient, our firefighters will ride in with the ambulance as well. And if we're not needed, then off they go and off we go.
So like level of capability is the same,
Yes.
just different use, essentially.
That's correct.
Okay.
So AMR has a paramedic on their ambulance. We have paramedic on our engine. So same level of care. So we can pass off. Now, if it's a basic life support ambulance that shows up and this person is more critical than basic life support, we can't turn the patient over from a paramedic to an EMT basic if the level of care has to be at that higher level. And then we would ride in or they would bring another unit in. Yeah.
Awesome. Thank you.
Yeah. Okay. So we're going to talk about a little bit about data. Not getting too detailed tonight. So this demonstrates our data from 2024. So we had 17,000, I'm gonna have to pick up the pace here. So 17,419 calls in 2024. And you can see that with the pie chart in the graph, that almost 10,000 were medical calls, medical related calls. And then we dropped down to good intent calls, 2810, 2,810. That means somebody thought there was an emergency, they thought something was happening, they called, we get there, we find out that there's not an emergency. So we end up clearing the scene. So yes, we got that many. Service calls, 2,584. That's everything from, I have a water leak in my home and my basement's flooded, or I need, my smoke detector's chirping at 3 a.m. and I don't know what to do. And so we respond and we help out. Then you can see false alarms, false calls at 805, then fires, 736. That includes structure fires, brush fires, car fires, that's all fires. And then hazardous conditions, no fire, 482, and then and so on. When we look at 5-year data from 22 to 24, or 3 years, I guess. I'm used to seeing 5 years every time I look down, but 3 years, that when we look at our incident totals, you can see that top graph, 17,515, then we had a little bit of dip in 23, then 2024, we're back up again. And then we talked about the looking at each of the zones. Well, actually, all of these are for the zones. What the calls respond to. So FMA stands for Fire Management Area, 31. So in 2022, they ran 1723, 1710, 1630. You get the idea. And then 71, you can see where the numbers are growing, then 72 and 74. So then we get into, we can look at EMS, we can look at fire, we can look at it however we choose to look at the data. So call types by response between 23 and 24. Fires, you can see, stayed relatively constant, 783 down to 736. EMS, we had an increase of 8%. Hazardous conditions, no fire, 98%. I mean, it wasn't a big number to begin with. And then service calls and so on. So we look at that, we compare, we look at trends. We try to look at 5 years worth of data. So we just don't want to react over 1 year. So here we go with the 5-year data. So we look at this 5-year data from 2019 to 2024. It looks, the difference looks a lot bigger than it really is. So this is our unit response that in 20, I cannot read my chart here. You may be able to read it better than me. But in 2021, we had over what we call unit responses. So about almost 23,000 unit responses. So when we have a call, it can be 1 engine, it could be 2 engines, it could be 5, it could be 7. So that's what we look at a call. We look at unit responses. So in 2024, we had almost 22,000 unit responses. So we had 17,419 calls, but we had 22,000 unit responses. I'll put the heat map up here for you. These are just a good way to look at it. It just gives you that effect right away when you take a look. This is from 22 to 24, again, the 3 years. And you can see the highest call volume in 71, 72, and then up into 74 in areas of 75. So again, that's really more of an effect for you to see what that looks like, the charts.
But question on that one.
Yep.
On more of a data nerd question than anything else. Is that similarly correlated to population density, do you think? Or is there like an actual sort of incidence in different areas drivers?
It's it's related to population density, definitely. Yeah. So there's a lot of factors that come into play: density, demographics, yeah, that type of thing. So we pay attention to all of that. So yeah. I wanted to demonstrate to you our mutual and automatic aid request given. So this is going outside our service area. As you can see to the left of the screen, how many times we're going to Portland. One thing that's important to note is that we are what's called AVL, GPS. So all of our units are GPS. We don't really have boundaries. So it's dispatching. Our dispatch center is in Portland. It's called BOEC. And it dispatches the closest units to an incident. So it doesn't care if it's Portland or Gresham. And so, which is great. So along that border to the west If we have fires, we have large incidents inside Gresham, we're grabbing Portland units too. So it goes back and forth. The same thing to the east into Corbett, a little bit to the north, you can see a little bit there. So primarily these calls, you can see about 1,168 times, was our match, 1,100. Stays pretty consistent that we're giving for automatic aid given. The beautiful thing about that is we don't have to build 3 more fire stations on the west boundary, and neither does Portland. So I'm going to pick up the pace here for the sake of time. Wellness, health and safety, another thing that we do with our firefighters, another program that's part of our operations. Some of the components included, it varies each year based on grants, funding, that type of thing. With our medical, physical exams, our hazmat team members go through that every year. But then our other staff, it just, again, we look for different opportunities, blood work, body scans. We this year did cancer screening. So we're looking for precursor with what we're exposed to. Firefighters are exposed to about 17% higher chance of cancer than the general population. So we're paying attention to that. Fitness program, our firefighters are required to work out every shift, 1.5 hours. It's the fitness for I like to say the obvious reason. We have peer support. Mental health is something we take very serious here in Gresham. So we have peer support, which is firefighters that are trained to take care of each other. So we have people that go through training. They're looking for signs with our own staff that, hey, okay, or we had a difficult call. They'll go meet with that crew. They'll meet with that staff and see if there's any needs. And if there are greater needs than that, then we have a employee assistance program through the city. But then we also have a third option that I'm really proud of that we have a 24-hour service with a psychiatry group that specializes in fire and EMS and police that we can call, and our members of our department can call anytime they want, and they can call that line. They get somebody on the other end, and they'll get them in immediately if they're in crisis. And so we offer that. It's anonymous. We just get update on how many times it was used and cost, and that's it. And so we make that available to our staff. So training, again, so training, we have a training division. It's a training chief. We have a captain in there, a lieutenant, responsible for coordinating our training, keeping up our certifications. And so firefighters, we have to keep up our firefighter certification, our EMS certifications, and all the certifications I mentioned earlier. So we try to have, we work with our regional partners in training as well. They do our recruit academies. They have a very full schedule. And we purchase and maintain all of our training equipment. So getting to administration, so I'll give you an overview of this. So with the administration, our staff, so these are people that work in the office that also work in this building. We're attached just down the hall. So myself, the fire chief, executive assistant is Randy Deverall. And underneath her, we have an administrative assistant, 2, 3, an administrative analyst. That's really our data, works with Bill, our finance, that looks at our data, is always crunching that for us. Then we have a logistics technician that's responsible for buying our personal protection equipment, uniforms, that type of thing. The senior management analyst who's from finance that's embedded with us. And then we have an assistant fire chief, and that's Jeff Hairston. He is over our battalion chiefs of operation. He's over training and safety, and then also over life safety or the fire marshal's office. Budget management, again, our senior management analyst is primarily responsible for that, works very closely with myself and Chief Hairston, and looking at the budget. We meet every Wednesday to go through it. Budget development, I won't get into the details, but it's a process we do with the whole department. It's not just myself and Jeff and Bill sitting down deciding what we need. It starts with the teams and so forth. Then we work with the city budget team to develop the overall budget, and then the fiscal year, you're aware of that, July 1 to June 30th. Procurement, purchasing, and vehicle replacement schedules. So fire trucks are expensive, and engines costing about $1 million. The ladder trucks about $2 million. So we really want to keep track of, and we get 10 years out of a truck or an engine, and then we have it in reserve for 5 years. So that lasts for 15 years is the idea behind that. So we look at those replacement schedules, equipment, heart monitors, which are very expensive, about $35,000. So the big ticket items, we keep a replacement schedule. We keep track of that, and we make sure that we are in concert with council with our budget and our needs, so. We are also responsible for facilities, new replacements. I mentioned earlier about some of our big projects with the Station 72 remodel, Station 73 workout room addition. Station 74 is going under preliminary architectural drawings for replacement. And then the new training tower, fire station replacement and additions, and then we work with the city's facilities maintenance team to maintain our stations. In administration with training and Chief Hairston, we do the new hire testing process. We have people that go out and help recruit, and we work with our human resources department for that to bring on new firefighters and to get them hired and through the background process and bring them on staff. Collective bargaining, so our local is Local 1062. I am very proud of our relationship with 1062, with the fire admin in 1062, with the city in 1062. We collaborate, we talk, we coordinate, we strategize. 1062 was the primary driver behind the 8 million that we just received. They were the primary driver behind the 500,000 we were able to receive from the state. But again, it's working with our city council, having that relationship, working with fire administration, city administration, and we are very fortunate here in Gresham to have that type of relationship. Then we have the fire marshal's office, and I will go through this pretty quick. So we're 5 minutes left. So the fire marshal manages our fire investigations, code compliance inspections, new construction inspections, plan reviews, fire alarm systems, sprinkler systems, special suppression, public education, and then liaison to inside outside agencies. They work very closely with code enforcement, with community development. We work in concert together when it comes to looking at building code, fire code, building safe buildings throughout the city. We have a team that are called deputy fire marshals, and that they are the ones that do the plan review. They do the plan review for all of these systems. They go out and do the new construction inspections. They attend pre-application meetings. They conduct fire investigations. So again, when we talk about certifications for the line, we also need to talk about certifications for this staff. They're certified in plan review, they're certified in code enforcement, they're certified in inspections, they're certified in investigations. So it's a lot of training. It's about a 2-year process to get them up to the level that we want for Deputy Fire Marshal 2. Emergency management, I believe this is the last slide. Emergency management is under the purview of the fire chief's office. Emergency management's for the entire city though. So it's not just about the fire department, it's about all of us. It's about the community. It's about the communities we serve. It's about working with public works, IT, police, fire, all of us. So it's a big ask. So the emergency manager role works very closely with the county. The county emergency managers works with the state emergency managers, and it's about mitigation. It's about planning. It's about the response and recovery after. It's not really the response as much as it is the mitigation and recovery processes. So a very important part of our operation. So when we look at these big events, it could be fire related, it could be police related, it could be IT, cyber attack. So it could be water issues, so our public works are really the leads. So it's not really about having one person that's emergency manager. It's about somebody that's coordinating and guiding and helping us through that process, because I'll stop there. And so, cause I could go down a whole nother rabbit hole with that. And it becomes very complicated, but we have to manage different things. People think of emergencies, they think of police and fire. They're not thinking about public works. They're not thinking about IT. So it's much bigger process. So we wanted to leave I know we're pushing 7 o'clock, but a few minutes for questions.
You know, people talk about drinking out of a fire hose. I felt like that was what we just did. So to learn about this, I have I'll try to lump my questions together for the sake of time, but going back to the 1.7 million PERS buy down, what's the operational effect of that going forward? So how much money is it saving annually? Or I assume that's why it was done. You bought down PERS so that it could be operation savings. And then the second question would be, on your capital spending, is all of that coming, when you build up that reserve, is all of that coming out of operating money, or is there some, and I realize for Station 74, you said you'd gotten some other funding, so are there other sources of money for that? And then the third question I had toward the end of your presentation, you talked about, well, your recruitment. And when I think about all the skills that the people you're hiring need, is it getting difficult, to find those folks? So,
Well, I'll start with the third one because I know that one the best, and I'm gonna look behind. There we go. She's ready for you on the other two.
okay,
Yes, thank you.
thank you.
So when it comes to recruitment, so the numbers have definitely drastically decreased as far as people looking for jobs in the fire service. And it's just there, it's a number of things that why people are tapering off wanting to become the fire department. You're working 24-hour shifts, your schedule's set for the year, you're picking your vacation, family, you're missing birthdays, holidays, those type of things. And so this is feedback we've been getting. Typically, going back 30 years, you look at a hiring pool, about 1,500 people for jobs. But we're very fortunate here in Oregon. We're doing pretty well. In our last application process, about 230 people applied. And so when it comes to the basic requirements, really it's graduating high school and having your EMT basic. And then we bring them on, then we give them everything else. And we train them through the academy. It takes about 14 weeks to get them through. And then if they come in, if they're not a paramedic, then we'll send them to paramedic school if they so choose. It's not a requirement. And so then all the other certifications for the special teams, we offer that over time. So, the numbers have drastically decreased for a hiring pool. And that's something that we're going to have to consider. We're going to have to look at part of our recruitment strategy and bringing people in. So the fire service as a whole is really trying to attack that problem.
So your first question was related to the PERS buy down. So for this particular program that we're participating in this time, the state offered a 25% match to whatever funds we contributed. So overall, the city is planning to contribute $8 million. The state will put in $2 million. And then so we put that in up front, it gets invested, and we will expect a rate of return on that. And then it will buy our rate down for the next 6 years. So by putting in the cash up front, we will have a lower contribution rate over the next 6 years that should be larger than that $8 million that we put in up front. So that's why we are participating in that program. Your second question was about our capital and our equipment replacement fund. For fire in particular, over the last 15 years or so, we have used a mix of saving up front for capital purchases, as well as we have debt financed some capital purchases when we have the opportunity to pair it with a larger debt issuance. Issuing debt for municipalities can be expensive. So for fire, we've tended to bundle it together with other things to help alleviate some of those one-time costs that come with debt. The contributions towards the equipment replacement for future purchases, as well as the debt payments, do all come out of the operating funds of the general fund. So, and I do know that we are running a little bit short of time. So if anyone doesn't get questions answered tonight, they can email them to Tristan and we'll make sure that they get addressed at the next meeting as well.
All right. So Chief, that was an excellent presentation. Thank you. It was very thorough.
Welcome.
Is there any other questions that we want to address quickly? All right. Well, thank you again, Chief. I can't wait to go tour. Next, we will turn over to committee business with the wonderful Larry Morgan.
Thank you, Chair and committee members. Just one quick item. The next subcommittee meeting will be planned for Wednesday, July 23rd. This meeting will be an opportunity to look at and review information from Police Chief Goldberg and the Police Department, kind of on the backdrop of this conversation. So we just plan on meeting here at 6 p.m. On the 23rd. There's one housekeeping item as additional. We don't currently have a meeting scheduled for August. Council will be, I think, just returning back from break. Staff will be here. However, Is there desire of the committee to meet in August? I know we talked about doing initially upfront meetings and then having a later trailing off during the holidays. So I want to get confirmation if we wanted to move forward with the August meeting or where people were at with schedules.
Can we go ahead and vote on that? So August or September?
Chair, I move that we cancel the August meeting and meet in September.
Okay, and are you good with that?
I probably won't be here in September, but that's okay. Not everybody can make every.
Yeah, that's fine.
All right, we will go for September.
Okay, one just housekeeping item. It looks like police chief will be out of town next month. So there's an option to do a preliminary budget kind of walkthrough with the budget team, and then perhaps a more involved data in later into the fall. Is the committee okay with that if we move the police to later as well?
Yes.
Okay.
Yes.
Perfect. That's all that we have.
Okay. Well, let me see if there's anything else here. If there are no other items of discussion, we will end the meeting.
Chair, if I may,
Yes.
in our packet today, I found a package of city law for volunteers that comes out of the city attorney's office. And then there's a letter for each of us to sign and say that we will read it and abide by it. So, I noticed it wasn't on the agenda, but I didn't want to get out the door without people taking note of it.
Thank you for that. I believe we got the city law for volunteers at the first meeting, but I did not see the form to sign. So thank you for that. We'll take care of that. Is there anything else? All right, this meeting is adjourned. Thank you.